anything else do you think we can do to reverse the trend that you've found, or the facts that you found?
Right. So I don't think we can put the entire responsibility on the patient. It is appropriate for patients to advocate for themselves when they're diagnosed with the breast cancer, and to know the appropriate questions to ask their surgeons and other healthcare providers, what their options are in the surgery and the complications associated with surgery, and why the surgeon is recommending that treatment. But there's also a responsibility and a role that we play as surgeons and healthcare providers. And so as new technologies are recommended through our national committees, we have to make sure that those recommendations are implemented throughout all of the communities in the United States.
Do you have any ideas on how we do that?
I know that's a general statement. So we will probably have to develop a tool that's almost that primary care doctors use. And so they have 15 minutes to see a patient, and they have to have sometimes a checklist and a reminder. Remind this patient to get a mammogram, remind this patient that blood sugars need to be whatever for diabetes. And so a modeling tool may have to be created or disseminated that can be used throughout a community hospital, an academic center, or wherever a patient may be, to make sure that the recommendations are being at least thought about and discussed with each breast cancer patient.
Boy, I agree with you completely.